that is a great question, and we are really experts at this PCOS dilemma. So, unfortunately, it's a big dilemma with many doctors. They don't know what to do because they don't understand it. There are so many papers published every year on PCOS and the so-called metabolic syndrome, and it's overcomplicated and total misconceptions. So the PCOS is caused by your having too many eggs. That's really funny, but I mean, it's great to have too many eggs because you'll have a late menopause, much later than average, maybe age 61 instead of age 51. But what happens is when you want to get pregnant and have a baby, that large number of eggs inhibits your pituitary gland from secreting FSH and LH, and so you never recruit a dominant follicle, and that's why you have irregular cycles and you either don't ovulate or ovulate late, simply because you have so many eggs inhibiting the pituitary. It's as simple as that. The obesity is not a problem, but what the approach I would recommend is rather than letting your eggs get older, we do the Mini-IVF. We'll certainly get enough eggs because that's what PCOS is. It's too many eggs. We'll certainly get enough. We'll freeze the embryos. So we're not allowing your eggs to get older, 8 years older, where they have a lower success rate. I mean, we'll go right to this approach. It would be advisable for you to lose weight, but you're not going to be suffering the problem of your eggs getting older and diminishing your chance of getting success, because we've already got those embryos frozen and we can help you lose weight. If you can't lose weight, okay, if you understand the risks, we'll still transfer the embryos to you. But the point is we don't feel that time urgency anymore because we got those embryos frozen. So we go right ahead to the Mini-IVF with you. Now, PCOS also is a woman's health issue. You should not be allowed to have those irregular cycles and estrogen dominant cycles without ovulation, because that creates a greater risk of uterine cancer later in life. So it's very simple algorithm for PCOS. When you're not trying to get pregnant, we'll put you on birth control pills, 21 days on and 7 days off, regular cycles, and your uterus is safe. And when you are trying to get pregnant, we do Mini-IVF. It's as simple as that. We do the IVF if you want to get pregnant. We have you on birth control pills when you're not trying to get pregnant. Now, your cycles will start getting regular as you lose eggs and age when you're over 40. So then you don't even have to be on birth control pills because you'll be having regular cycles. But before you're in your 40s, we got to try to get you pregnant with Mini-IVF because your eggs will be more fertile then. So if you want a more full explanation, it's certainly on my website. I have a great page on PCOS, and I explain this to you. Or, you can call up and arrange a Zoom consult with us. There's no charge. I mean, this is my calling to help people with what I consider the first commandment in the Bible, which is be fruitful and multiply. And so just give us a call and make an appointment, and we'll do a Zoom call. And I can give you more details or answer any other questions.